Hi, I'm Dr. Janae Brown,
And I'm Dr. Nicole Palermo.
and we are two physical therapists at Physical Therapy San Pedro. Today, we are going to come talk to you about how to train through pain. And we are going to give you some three simple, easy ways that you can train through pain. So, Dr. P, we're in the business of pain, not just because we're injury specialists, but also we've had pain ourselves, right?
Just because we're PTs doesn't mean we're perfect.
Exactly.
And never experienced pain.
Yeah, exactly.
It happens.
It happens. So,
we see a lot of patients that come in with pain, right? And they
yes,
just kind of freak out. They don't know what to do.
Yeah,
and so
exactly.
we've been inspired to
yes,
talk to you guys about how to continue training with pain.
exactly. And pain tends to paralyze people at times, and it will stop us from moving. It'll stop us from doing simple and easy things. So give me some reasons why you think, Dr. P, that people freak out with pain when they get pain and freak out, and what are some reasons that they stop moving and exercising and doing normal stuff?
Yeah, I think a lot of people get told a lot of different things, right?
Yeah.
So stop doing what you're doing, rest,
Yep.
ice, elevate and compress.
Yep.
Or just stop doing what you're doing for 2 weeks until the pain goes away and then come back. Or medicate.
Yeah.
And so there's just a lot of confusion about, okay, what do I really do? But, you know, the body wants to continue doing a lot of things and wants to continue moving. So we just want to help give you guys a safe approach to continuing to move through pain.
Yeah.
Yeah.
I feel like, there are some really simple ways that we can do this. Dr. P and I have come up with three great principles that can keep you sort of moving and training through pain, and not being scared to stop moving. So Dr. P, give us one of those first principles that we talked about, first ways that our followers, our listeners can start to utilize and try to train through some of their pain.
Sure. Let's get started. So I think the first one is good because we need to learn how to move within certain limits.
Yeah.
So let's say, example, like you have some back pain or hip pain.
Yeah.
We need to find kind of some parameters that we can still move within,
Yeah.
but not aggravate our pain.
Yeah.
So there's certain variables, and if you read our blog, you can see the full list of all the variables. But variables that you can manipulate so that you don't push yourself to do too much. So let's say a back squat, right? If it hurts to do a full back squat, well, why don't you manipulate the depth of that squat? Or maybe if you go slower through the squat, or add a box to your squat, then you can eliminate some of that pain. Other variables, for example, are controlling the pace, controlling your frequency, duration of activities. So sometimes you just are doing shoulders for way too long, and
Yeah.
your endurance of your rotator cuff muscles just aren't up to that challenge. So if you can just, modify how long you're working on something, and just, getting used to controlling certain variables
Yeah.
can help not push you over that threshold.
Yeah.
And that's why we're here.
Yeah.
I think physical therapists are just super skilled at working these little variables. Yeah. And modifying your sport so that you can continue training but not throw yourself over the edge.
Yeah, there's like no magic solution oftentimes to when you're in pain, when you're having an injury. And like Dr. P and I have said, we have had our own injuries that we've had to learn how to train through and to work through. And it is just that, like, we figure out how do I modify this particular thing so I can do it, but maybe, not do it with pain. So, and that's why people come to us, and when we're working with patients, we ask them to do the movement and we watch how they do it. And we're trying to cue it so that they're doing it the most correctly, right? Mm-hmm. But also giving them the ability to do it. And these are those variables that we use to sort of manipulate when we're working with patients. So that's the hard part about sort of trying to rehab yourself sometimes, is just really not knowing which of those that need to be modified. But find it. You can look at all these different things, find the sweet spot, of moving within your limits. So that's a really great way to continue a tip we have for you to be able to train through pain. The other thing is, you know, my big thing that I tell all my patients is, you know, don't aggravate your pain. Like, your body is smart, and pain is a warning sign. It's like an alert, you know, don't do this. And a lot of times we ignore that warning sign and we keep doing something that our body doesn't like. But our body is smart. It's going to tell you, I don't like this. I don't want to do this. So listen to that. Don't aggravate that pain. It seems really simple, right, Dr. May? But we also know that there are times when people can't control that variable. So if, for example, sitting is an aggravating thing for you, and you sit, you know, because you're in meetings and you sit, or you have to sit to drive to work. We know you have to do that. But find ways to not sit as much, or know that that's your problem. So when you're in that position, try to move other parts of your body, and, you know, and keep things moving so that you're not irritating that area of your body as much as possible, especially like sitting is with your back. But it could be another thing, right? So it could be running, it could be lifting, repeated lifting. You know, maybe you're able to lift something from the ground, but maybe you need to do it, not repeat lift, or maybe it's the amount of weight you're lifting. So don't aggravate it. Do not aggravate your pain. If you can figure out how to not aggravate your pain, then that healing process doesn't get disturbed, right? Because I feel like sometimes it's like your body will, it has a time frame for healing. And we talk about this a lot. You can't change that timeline. The body's going to heal, but we can either support that timeline or we can disrupt it. And we disrupt it by aggravating pain. And if we keep aggravating it, we just go in a cycle. And sometimes we don't know what that thing is that aggravates your pain. And sometimes you don't know, but our goal is to just not aggravate it. Okay. Yeah. So yeah, that's my big one.
I couldn't agree more.
Yeah.
She says it the best all the time. Well, just don't aggravate it. It does seem so simple, but really,
yeah.
If you try your best to, just to keep that healing process going.
Yeah.
And in addition to that, we'll go into our third, our third principle, move what doesn't hurt.
Mm-hmm.
So if you just have some patellar tendonitis, or you rolled your ankle, or, you know, I have patients coming in with a boot and crutches, you know, just because your lower body is out of commission for a little while and it's healing, you can still be doing upper body and core and stretching. So there's a lot of other ways. So don't lose all your gains just because you have a minor setback. Move what doesn't hurt, because the body loves movement and it's still going to crave movement. And if you stop moving, your injury is going to last longer.
Yeah,
okay?
Absolutely. Yeah.
So, you know, now we tie it all around. Move within certain limits, adjust variables, don't aggravate your pain, and move what doesn't hurt. That's like a perfect recipe to continue your fitness while you're healing.
Yep, absolutely. Okay. Those are the three big things that we feel that can help you train through pain. And I feel like a lot of times people just, like, again, don't know what to do. You know, they've heard so many routes, they've heard so many ways, they don't know what to do, so they stop doing everything altogether. And we want to encourage you guys not to do that, because you have a lot of options when you sprain your ankle to keep training if you're an athlete, and you need to be, you know, you have to keep everything else strong. You have to be able to do everything else you need to do. And you're not going to feel good either when you're not trying to do, you just won't feel good about yourself if you just stop everything.
You sit on the couch for one whole week, nothing's going to feel good after that.
Exactly. So the motto isn't train through the painful thing that is bothering you. That's not what we mean.
And it's not no pain, no gain.
Exactly.
Right?
We're not a no pain, no gain type of place. It's find that sweet spot. Find those things you can do. Move what you can move. And don't stop moving, because we want you guys to be able to train through your pain, right? Cool stuff. So if you don't know what to do, if you don't know how to do that, then you need to find a super physio like ourselves, a PT, a physical therapist in your neighborhood, in your neck of the woods, that can help you and guide you through these principles. That's what we're here for. And if you're in our neck of the woods, hit us up. We'd love to help you and get you on the path towards training through your pain, through healing. What else should we let them know? Where else can they find us?
You guys can find us on Instagram, but the biggest thing we wanted to let you guys know is that we have some online programming that we are working really hard on developing. Yeah. So stay tuned for that. Already on our Instagram, there's been little snippets of video on that. So if you're interested, or if you're a follower that's in a different state or a different country, and you want in on some of the magic that we do here, the online programming is going to be for you.
Yes,
So-
hopefully we'll have that out before the end of the year. We're posting some snippets onto our Instagram right now, so you can kind of check out what we're doing, give us some feedback if you like it, don't like it, if you have any tips. We're open to, we want to develop really great programming for people that are looking for content, good content. So you can find us on Facebook, Instagram. You can go on, look up our blog, Physical Therapy, sanpedro.com. We have other blogs on there that you can read, and some cool information on there as well. And yeah, I think that's it. So thank you guys for tuning in. Yep,
Don't
you got
be afraid
this.
of pain. You can train safely through pain.
Absolutely. You guys have a
Take care,
great day.
guys.
Bye.
Bye.